I have worked in emergency rooms for over 30 years, and I need you to hear me clearly. Most people over 60 will not survive their first heart attack if they are alone. That is not fear-mongering, that is a medical fact. Almost half of heart attack deaths happen before the patient ever makes it to the hospital. The reason is simple. People waste time. They hesitate, they panic, and they do not know the simple, life-saving actions that can keep blood flowing long enough for help to arrive. The brutal truth is this: if you do not know these steps, you could be gone in minutes. Every single day, I have seen patients carried into my emergency room who could have lived if they had just done one or two things differently at home. A crushing pain in the chest, sudden breathlessness, dizziness, or a cold sweat. By the time many arrive, the golden window of survival has already slammed shut. In this video, I will walk you through the essential life-saving tips every senior must know to survive a heart attack when nobody else is around. One of the most powerful techniques is something research shows can make the difference between permanent damage and walking out of the hospital alive. Most people have no idea it exists, but after today, you will. Before we dive into the details, I have a quick question for you. How old are you? Tell me in the comments. I personally go through and reply to every single one, because I view this channel as a conversation in my clinic. Now, let us begin with the very first step that decides if you make it out alive. The most critical action when you feel the signs of a heart attack is to call emergency services immediately. Do not wait it out. Do not second-guess yourself. Do not tell yourself that maybe it is just indigestion or that it might pass. Every minute you wait, the damage to your heart muscle grows worse. Cardiologists explain it in simple terms. Time is muscle. The longer blood flow is blocked, the more heart cells die. According to the American Heart Association, patients who call emergency services within the first few minutes of symptoms have survival odds up to 50% higher compared to those who delay. Yet, tragically, many seniors downplay their symptoms because they do not want to bother anyone, or they believe they can tough it out. That hesitation can be fatal. If you are over 60 and you ever feel crushing chest pressure, sudden shortness of breath, or an eerie cold sweat, act as if it is a heart attack until proven otherwise. Pick up the phone and dial emergency services without hesitation. Once you have called for help, the next move can be the difference between life and death. You should chew an aspirin if it is available and you are not allergic. Why chew it? Because aspirin is one of the most powerful clot-fighting drugs you can get without a prescription. Heart attacks happen when a clot blocks blood flow. Aspirin works by thinning the blood and stopping that clot from growing larger. Speed matters. Swallowing an aspirin whole can take over 10 minutes to break down in your stomach. Chewing it breaks it apart instantly, allowing the active ingredient to absorb through your mouth and stomach lining within just minutes. In a situation where every second counts, those minutes can save your life. If you have an allergy to aspirin or a bleeding disorder, skip this step. For everyone else, keeping a bottle of uncoated aspirin in an easy-to-reach place is one of the smartest emergency precautions you can take. While you are waiting for paramedics, you must also consider how you position your body. Loosening tight clothing and sitting upright helps reduce the strain on your heart. Many seniors underestimate how quickly restricted circulation and poor posture can make a bad situation worse. Tight belts, waistbands, or collars compress blood vessels and make it harder for your body to circulate oxygen. Sitting upright relieves pressure on your diaphragm and lungs, making breathing easier. Lying flat actually forces the heart to work harder. By sitting up, preferably with your back supported, you improve airflow and lower the pressure inside your chest. This tiny adjustment can mean the difference between gasping for air and staying calm enough to survive until help arrives. Give your heart room to breathe. If you begin to feel faint, dizzy, or like you are about to pass out, there is a physical action you can take. Doctors call it cough, CPR. When you cough deeply and forcefully, your chest muscles contract and create pressure that forces blood out of the heart and into the brain. It is not a replacement for medical treatment, but it can buy you valuable seconds of consciousness. Take a deep breath and cough hard and strong every 2 seconds. This creates artificial heartbeats that keep oxygen flowing to the brain long enough for help to take over. One of the most overlooked survival steps is making sure help can actually get to you. You must unlock your front door and keep your phone within arm's reach. It sounds small, but in a crisis, it can mean the difference between being found in time or being trapped behind a locked door. Paramedics are trained to break in, but every extra barrier costs time. Unlocking your door in advance removes that risk. Always keep your phone nearby, especially if you live alone. Do not leave it in another room or on a charger across the house. In the middle of a heart attack, panic is your worst enemy. Fear releases stress hormones like adrenaline, which spikes your blood pressure and makes your heart work even harder. This is why taking slow, deep breaths is so powerful. Deep breathing increases the oxygen reaching your blood and signals your nervous system to calm down. Place a hand on your stomach. Inhale deeply through your nose and exhale gently through your mouth. Think of each deep breath as buying yourself more time. The final and most critical rule is to stay as calm and still as possible. This is perhaps the hardest instruction to follow, because when we feel pain, our natural instinct is to move, to pace, or even to try and walk it off. You might feel the urge to go to the bathroom, to splash water on your face, or to look for a family member in another room. But you must resist these urges. Every single step you take forces your weakened heart to pump harder, demanding oxygen that it simply cannot get. Think of your heart during an attack like a fragile engine running on fumes. Every movement revs that engine and risks blowing it apart. When you stay still, you are essentially putting your body into a low-power mode, preserving every bit of energy for the vital organs. Stillness and conserving energy are your primary weapons for buying time. Do less, breathe more, and let help reach you. If you are on the floor, stay there. If you are in a chair, do not get up. Your only job is to be a stationary target for the paramedics so they can find you and treat you immediately. It is also important to understand the mental side of this stillness. Panic creates a physical cascade of chemicals in your bloodstream. When you allow fear to take over, your brain sends signals to release more cortisol and adrenaline. In a healthy person, this is fine, but in a senior experiencing cardiac distress, this chemical surge acts like poison. It constricts your arteries even further. By consciously choosing to remain still and silent, you are manually overriding your body's panic response. You are taking control of the situation. Knowing exactly how to act can be the difference between tragedy and survival. Let us quickly recap the journey we have taken today. From the moment you feel that strange pressure, you call emergency services without a second of delay. You chew that life-saving aspirin to break up the clot. You loosen your clothing and sit upright to give your lungs space. You use the forceful cough technique if the world starts to spin. You ensure your door is unlocked and your phone is clutched in your hand. You breathe deeply to oxygenate your blood. And finally, you remain as still as a statue. Each one of these actions buys you precious minutes. And in the world of emergency medicine, minutes are the currency of life. We often talk about the golden hour. But for a senior alone, it is really the golden 10 minutes. What you do in those first 600 seconds determines the quality of the rest of your life. It determines whether you return home to your garden, your grandchildren, and your routine, or whether you face a long, difficult recovery with a damaged heart. I want you to take a moment right now to visualize your own home. Where is your aspirin kept? Is it in a high cabinet or somewhere you can reach while sitting on the floor? Is your front door easy to unlock in a hurry? Do you have a habit of leaving your phone in the kitchen while you are in the bedroom? These small daily habits are the foundation of your emergency plan. Preparation is not about living in fear, it is about living with confidence. When you are prepared, you do not have to panic, because you already know the moves to make. If you found value in this information, please like this video and subscribe to our channel, Senior Routine, for more life-saving advice tailored to our community. We are more than just a channel. We are a support system for everyone navigating the beautiful journey of life over 60. Before you go, I have two things to ask. First, where are you watching from today? We love seeing how far our message reaches across the world. And second, do you have an emergency plan or a medical alert system ready in your home? Or perhaps you have a story of a time when quick thinking saved you or a loved one. Drop your answer in the comments below. I personally read and reply to every single comment because your story matters, and your experience might be the very thing that gives someone else the courage to act fast. Please share this video with your friends, your siblings, and your neighbors. You never know whose life you might be saving just by clicking the share button. Stay safe, stay prepared, and remember that knowledge is the ultimate power, especially as we age. Thank you for spending this time with me today, and I look forward to seeing you in the next video.